Hello, welcome to the second video about the Nobel Prize for Physiology and Medicine of 1901. Emil van Behring was the prize winner, and he held a lecture about serum therapy in therapeutics and medical science. And we will give a summary of that lecture. You see some nice stamps made in commemoration of his and Paul Ehrlich's Nobel Prize. And here we go with the summary itself. The lecture first summarizes how diphtheria serum therapy works. A quote: "Serum therapy is an antitoxic or detoxification method. It is based on the view that the parasites causing diphtheria," that's the disease we're talking about, "do not themselves cause diphtheria, but that they produce poisons which cause the disease to develop. Without this preliminary work by Luffer and Roux, there will be no serum treatment for diphtheria. When the diphtheria poison is rendered harmless within the human organism, then the diphtheria bacilli we absorb without suffering harm." That is to us, of course. We do suffer harm. The bacilli, of course, do suffer harm. "The poison excreted by the bacilli is the weapon against the human being, without which weapon the bacilli would be delivered over to the natural prophylactic power of the living human organism, so they would be destroyed." Brentano discovered 80 years ago the diphtheria bacilli are first located in the pharyngeal amygdala, an almond-shaped structure of the brain located in the pharynx, also known as tonsils. They react principally via the breath, but also by nourishment. In the niches and small cavities of the amygdala, they can multiply and excrete their poison. That is, the bacilli, the diphtheria bacilli. The diphtheria poison gets into the bloodstream by way of the lymphatic vessels and starts up inflammatory processes from there in the various organs. If we introduce the diphtheria serum as an antitoxic in the blood, this antitoxic will reach all parts of the body. If the diphtheria bacilli have not yet begun their destructive activity, then the secondary inflammation phenomena will not arise. Here you see a patient, and you can see that in the neck, in the tonsils, it is swollen because of the inflammatory processes caused by the bacilli. If the toxic process has already begun, then the already existing inflammatory processes will follow the natural course, for the antitoxin, the serum, exerts no influence on the substrate of the inflammation and not on the cell and the organs. All that can influence the existing disease is firstly to harmless the poison, and secondary to prevent the entry of fresh bodies of active poison. The diphtheria serum has an abortive effect, but it's not the disease that is cut off, the bacilli, but the creation of new diseases engendering substances, the poisons, that is attacked by the serum. It will be seen how important early use of the diphtheria serum is, and he then points out, that's Behring of course, that there is a certain time needed for the serum to work inside the body, which is several hours. He therefore recommends not to keep injecting the serum under the skin, since it only reaches the bloodstream via the lymphatic vessels, that takes time, but to immediately inject the serum into the blood vessels, faster absorbance. The arrival between infection and detoxification can mean the difference between life and death. According to the experimental investigations by Dr. Knorr and Dr. Ransom, about 8 hours can be saved in this way, thus injecting in the blood and not under the skin. Furthermore, it is possible to have a local effect on the poisoning production localities by using dilute serum solutions as a mouthwash to rinse the poisoned pharyngeal organs. Here you see the amygdala and it is infected by diphtheria. You can see that in the gray here. He then, that's Behring of course, starts to recognize the position which Serum Therapeutics has gained in the treatment of diseases as compared with other methods in medicine. Behring describes that humoral pathologists and solipsistic pathologists have been in opposition to one another, but last century the solipsistic pathologists have gained the upper hand. That's what you call a science war. Interesting enough to investigate further another time. Virchow has given the solipsic pathology, difficult word, the foundation of cellular pathology, the old humoral pathology having finally laid to rest. That is the pathology based on fluids, like blood and other slime, that sort of things. He also points that at a change in solipsistic therapy since Lister introduced the practice of not treating wounds with salves and balsams, but leave the wound undisturbed, since salves and balsams contain harmful agents. Yeah. He underlines that detoxification of the antitoxic serum therapy is in fact a form of humoral therapy. The serum does not influence the diphtheria bacteria or the human cells at all. The antiserum acts on the body fluids in the body and in the lymph. It does not neutralize the poison that are inside the body cells, only in the blood. Humoral pathology therefore may be wrong, but humoral therapy can work. He continues to label serum therapy as etiological therapy in contrast to symptomatic therapy. In other words, it tends to attack the underlying cause and not just the symptoms. Serum therapy does this by leaving the cells at peace, and noxious agents are kept out or are removed from the body fluids. Again, the infection bacilli are not killed by the serum therapy, only the poison is contradicted. Here you see an antibody binding to an antigen, the serum and the poison. And why does it work? Because they just fit in each other like a lock and a key. He, Behring of course again, then states that identifying the poison has led to the creation of an antidote. It is his opinion that the antitoxic neutralizes, rather than makes harmless or destroy, the toxin. The toxin is in effect inactivated by the toxin protein, not chemically altered. Thus the cause of the disease is tackled in the body fluids, not in the organs of the cell. You see, it's not completely clear what that inactivation means. It is only clear that it's not a chemical alteration. It's another alteration, but not clear what it means. Later it was found out. Von Behring then shifts his attention to tuberculosis, another dangerous disease in that time. Still, tuberculosis in cattle is one of the most damaging infectious diseases to affect agriculture. It is feared as being the carrier of tuberculosis for humans, though R. Koch recently disputed this. He underlines that in different countries or in different regions, if the same country the disease does not always strike with the same violence and frequency. Attention is given then to why this is the case. At first it was believed that different breeds of cattle have a different reaction to tuberculin inoculations. Later it was discovered that the difference was dependent on whether any or a few cattle are kept permanently in the same stalls. Cowhouses with 20 and more cattle were heavily vitiated, and when the few cattle were housed together, this was hardly ever the case. So it's probably a hygiene factor. No correlation between the number of bovine tuberculosis cases and the number of human tuberculosis was found. So there seems to be no connection between the two. This led him to the following conclusions. Him is Behring. Whether or not an animal dies after being affected with tuberculosis virus depends on origin and special composition of the virus, the method of application, and the dosage. Here you see again a picture of an antibody. You see it is shaped in 3 dimensions. This possibly has to do with the inactivation. Maybe the shape is changed. Not the chemical structure, but the shape. And then it doesn't fit anymore with the antigen. And so. Okay, Van Behring then continues to give examples illustrating what is written above. This is dealt in the last quarter of the lecture, but it's skipped here. Not that it's not interesting, it is very interesting, but well, it's difficult to summarize. So probably, if you were interested, best to read it yourself. In his final remarks, Behring says that he will continue to find a way to immunize cattle for tuberculosis, and that he will use the Nobel Prize money to do this. He mentions some promising results. The next step, of course, is to find a way to immunize humans against tuberculosis. Well, with hindsight, we can say that unfortunately Van Behring never achieved these results. Tuberculosis was fought, but in another way. Well, this is a summary, of course, of the lecture, especially the last part is even skipped almost in totally, the last quarter. If you're interested, you can best read the lecture completely, and that's easy to do. You have to follow this link to the official Nobel Prize site where all the information you see here is coming from. You can see that you can type over this link, or maybe I will stick it into the description by the video. You can press on it and then you can go to the lecture itself. Well, thank you for watching, and maybe until another time.